Hey guys, welcome back to the fourth episode of my series. Today we're going to be talking about postpartum depression. So I picked this topic because it's not really something that we talk a lot about during our clinical, and I thought it would be really important to kind of bring some awareness to it, especially because a lot of us are going to grow up to become parents and new moms. So get your tea ready, and let's get into it. So postpartum depression affects a lot of moms. An article released this fall concluded that 1 in 7 women actually develop postpartum depression. This is a massive number, and as nurses, we need to make sure our families understand PPD and are prepared for what challenges are related to it. PPD most commonly occurs within the first 6 weeks after childbirth, but can occur during any trimester of pregnancy. As nurses, it's important that we identify some of the risk factors for PPD so that we can educate and prevent decreasing the risk for new moms. These risks include a history of depression and anxiety either within yourself or if you have family history, obstetric risk factors, including emergency C-sections, hospitalizations during pregnancy, preterm or low infant birth weight, and umbilical cord prolapses can actually lead to a higher risk in developing PPD. There are also social factors involving a lack of social support, domestic violence in the form of physical, verbal, or sexual abuse, and lastly, smoking during pregnancy. Certain lifestyle habits can also lead to an increased risk of developing postpartum depression, such as poor nutrition and eating habits, sleep cycle, physical activity, and lack of exercise. Important learning I had was in regards to the nursing process. The nursing process is a 5-step process that involves assessment, analysis, planning, implementation, and evaluation. Using relational practice, questions I'd have would be as follows. So for the assessment, I'd like to ask, how did mom score on the emotional status of the bubbly? Does mom have a history of depression and anxiety? For analysis, I'd ask, how does the mom learn and what's her diagnosis? For planning, I'd ask, what does mom want to include in her teaching plan? Is she aware of any gaps in her education? Is she motivated to learn, and is the learning environment a positive space? For implementation, I'd ask what interventions are being implemented and who are we involving in the process. So would mom like to have a significant other or family involved, or would she like it to be just one-on-one? For evaluation, did mom meet her goal? Can she successfully use the teach-back method? Throughout the teaching process, it's very important to focus on the way you're communicating. Therapeutic communication involves using silence, recognition and acknowledgement, active listening, seeking clarification, summarizing, one-on-one with mom, or involving their significant others or any other family members depending on the preference as mentioned. And that's all for postpartum depression. Check out any of the articles that I have for some more learning, and I'll see you in the next one. Bye!